Okay. Can everybody see my screen?
Yep.
Thumbs up. Okay, perfect. And this, everyone can see this.
Yes.
Awesome. Okay, thank you. Welcome, everybody. Happy to have you guys here at our Mom Masterclass. Go ahead and we'd love for you guys just to drop in the chat something about you. Like tell us your name, where you're from. Just kind of let us get to know you a little bit. If you have kids, how old they are, or if you're pregnant, just basically what stage of life you're in. You want to be pregnant, you are pregnant, just had a baby. Let us know. We'd also love to hear where you're tuning in from. I'm from Arizona. A few of my Arizona girls are on here.
Arizona as well.
Okie dokie. And then Kayla, if you don't mind keeping an eye on the chat as well, or we'll kind of go back and forth with that. If you guys have questions, feel free to drop them in the chat as we make our way through this. But let's get started. I'll quickly introduce myself. So, for those of you who don't know me, I'm Chelsea. I've been on a fitness journey, I would say, really since college, where I was a girl that wanted to lose some weight. I had gained weight the last year of maybe high school, and I didn't really realize it till I got to college. And I was like, oh, I don't like this. And so I was one of those girls that tried to do everything to lose weight, probably not the healthiest way, like not eat enough. I just had a latte for breakfast every morning. I would try weird diets with my friends where we would just eat basically like spinach and protein shakes, alternate throughout the day, and I would last for maybe a day. So, and then I'd realize this isn't working for me. And then I became a nurse, worked night shift, and realized how quickly I was becoming unhealthy. Terrible eating habits, heartburn at the age of 22, feeling like crap, getting sick all the time. And that's when I kind of dove into like wellness. Like, what does it actually mean to be healthy? How do I actually eat well? Hired a trainer that actually led me down kind of a bad path. And that's a story for another day. But I've come full circle to having like true balance and truly understand what it means for me to be healthy and live a good life. And now I've had two babies. So we're kind of going to talk about that postpartum journey.
Okay, and hello everyone. I am Kayla. I started my fitness journey about 10 years ago, and prior to that, I was kind of like Chelsea, trying all the things. I was a big cardio girly, like always doing cardio, did not want to lift weights because I thought it'd get me bulky. Did not eat enough food. Like I remember I would take literally spinach salads to lunch, like spinach. And so my husband started his fitness journey and got me really curious and kind of took me under his wing to start my journey. And then I ended up hiring a coach who just forever changed my life. She just taught me all the ins and outs, all the truths to taking care of my body, nutrition, all of that. So I completely, as you can see, I was super skinny here, transformed my body, put on some muscle, and just felt the best I've ever felt. And I maintained this lifestyle for about 8 years, had my son when I was 33, and had more work to do, obviously, after having him postpartum. But really, I had such a great and healthy, active pregnancy. And even after postpartum, like my body kind of went back to how it was just because of all that work that I did pre-pregnancy, pregnancy, and it made a huge difference to postpartum. And this is where I am today. And honestly, I can say, you guys, I am 35 now, but I feel the best after having my son. I feel the most confident I've ever felt. And yeah, we're excited to share how you can feel that way too. So, our goals for you is that you will learn how to not gain too much weight while being pregnant so that you feel comfortable in your skin postpartum, how to reduce the risk of health complications for you and the baby, and how to stay healthy and active throughout your entire pregnancy and postpartum, physically, but also mentally as well. You will leave our class tonight with modifications to diet and workouts for each trimester and postpartum, a process on how to lose the baby weight postpartum, and how to heal and prevent your diastasis recti.
Okay, awesome. So just a few pregnancy statistics and a little bit about why all this matters, the stuff that we're going to talk about. So 60% of women are going to have some level of diastasis recti or the splitting of the abs. It's totally normal. It doesn't mean anything's bad is happening. Your body is growing. Your ab muscles have that little connective tissue. They're going to naturally split a little bit with the growing baby. You just don't want it to be too severe, and we're going to talk about that. But most women experience this, so it's nothing you did wrong. It's very normal. I just wanted to hit on this. Um, in the United States, we have like the highest maternal mortality rate than any other developed country. So we have the most women that die in childbirth than any other developed country with our level of medicine, which is very, very odd. I don't really know the reason to this. People would criticize our healthcare system, but I would also want to look to like the health of the patients, the moms, and say like, are we healthy? And we're having babies, maybe not in the most healthy state. So I kind of want to attribute that as part of it, just in my theory. 5 to 8% of women are going to develop preeclampsia, which is very dangerous. 5 to 9% are going to get gestational diabetes, also dangerous. And 60 to 20 or 6 to 20% of women are going to have some level of postpartum depression. And 75% of women will remain heavier about a year after giving birth, so they won't lose the baby weight. Why are we talking about this and why does all of this stuff matter? It's because we can control a lot of this. We can't control everything, right? There are so many things that are outside of our control when it comes to our babies in pregnancy, but there are things that we can do to take care of ourselves and to take care of our kids. And what I want you guys to understand is that this is about so much more than aesthetics and what you look like. Like, yes, that's important and you want to feel good, but this is about your health, about your baby's health, about minimizing pain, about minimizing risk to you, and having a good postpartum experience mentally, physically, all the things. It's so much deeper than what you look like. It's really important.
Mhm. So your pregnancy dictates your postpartum. So if you take a look here at Chelsea and I, we are like probably, I don't know, if we were 10 months post or 10 months pregnant, excuse me. And then here we were like 3 months postpartum. And Chelsea and I we didn't just get lucky. The baby weight just like, oh, just, magically came off. We worked hard, not only pre-pregnancy, we really worked hard on our bodies, but we were active throughout our pregnancy. And that made a big difference postpartum. So everything that you do, not only pre-pregnancy, but throughout your pregnancy, it makes a difference postpartum. I mean, Chelsea and I, we have family, hereditary diseases and things like that. But because we prioritized our health, it has made such a big difference for us. So it wasn't just luckily it happened for us. Like we worked hard for it and we knew exactly what to do throughout our pregnancy and postpartum. So weight training and a healthy diet should come with you through every stage of life. I know some women have that mindset of, oh, pregnancy, I can do whatever. And it's not a time just to slack or just have that mindset because it will make a big difference throughout your pregnancy. So again, all stages, pregnancy and postpartum, it makes a difference. Okay, so let's dive in. We're going to talk about pregnancy tonight. So being pregnant, okay, who's pregnant? Drop it. If you are pregnant, we want to celebrate you. Tell us how many weeks you are, which trimester you're in. But being pregnant is such an exciting time in life, as we know, but there's also a lot of changes that are going to be happening with your baby or with your body because you're growing a baby. So it's important to have a healthy and active pregnancy that involves a well-balanced diet and workouts tailored to each trimester. So let's just talk first about some essential nutrients that you need throughout your pregnancy. So folic acid prevents neural tube defects. This is found in leafy greens, citruses, fruit, cereals. Iron supports increased blood volume. That's found in lean meats, beans, spinach. Calcium supports fetal bone development. That's found in dairy, almonds, fortified plant milk. Protein is still very important. I know sometimes we have aversions, which we're going to talk about that later on, but that's important. It supports growth. It's found in eggs, poultry, tofu, fish. Obviously, certain fish. We'll get to that in a second. Omega-3 fatty acids. This is so important for brain development. Found in salmon, flax seeds, walnuts. So these are the things that you want to make sure you are getting if you are pregnant. Some foods to avoid and limit: raw or undercooked meats, seafood and eggs, risk of infection, unpasteurized dairies and juices, risk of listeria. High mercury fish, shark, and swordfish are examples of that. This can affect the baby's nervous system. And then caffeine, of course, the limit too. If you're a huge caffeine drinker, you really want to try to only have 1 cup. And then, of course, alcohol you avoid entirely.
All right, so let's talk about just a few common things you might experience during pregnancy and just a couple really quick interventions, things you can do to help prevent or treat it. You may have already noticed if you are pregnant now or have had babies that you're more prone to constipation. And there's a few reasons for this. There's hormones that actually slow down our gut motility that happen even in the first trimester, but then as your belly grows and baby grows, it actually smashes your intestines and there's just not as much room for everything to move around. So you're way more likely to get constipated. So if you're already prone to that to begin with, you are going to have to be extra intentional to take care of your gut. What we recommend is lots of fiber. You should have about 14 grams of fiber per every 1,000 calories. On average, women need about 25 grams of fiber per day and lots of fluid. So that's what you can do for that. Talk to your doctor if you need Miralax. It's generally a more safe supplement that you can take. But of course, always talk to your doctor. Heartburn, this is also going to become more common as your belly gets big because, again, there's just no space in there. So there's no space for anything to go. So you're a lot more likely to deal with that reflux, which can be so painful. I never realized how painful reflux could be till I was pregnant. I was like, oh my gosh. I got it for sure. It was awful. So things that can help with this, small meals instead of big meals, limiting fluids with meals. So you want to stay really hydrated while pregnant, but you might have to space it out and be sipping all day long versus having a bunch of water with a meal. Limit caffeine and spicy foods or just any foods that trigger it. For me, spicy definitely triggered it. Don't lay down right after you eat and be cautious with medications. Another common problem that actually can be very dangerous is hypertension or high blood pressure, which can lead to preeclampsia. And what we need to do for this is to monitor that you're not gaining too much weight. Watch your sodium intake because that can affect your blood pressure. Make sure you're exercising. Go to your prenatal appointments and get things checked frequently so they can catch anything. It's very likely to lead to needing to be induced or having a C-section or to be more closely monitored at the end if you do have high blood pressure. Lifestyle factors of being active and just staying healthy are going to help so much with preventing this. Nausea, vomiting. So sorry if you're getting sick. Have small meals, have those little suckers on hand, and just bland foods. Hopefully, those things help a little bit.
I was super nauseous with my little guy. Okay, so let's dive in and talk about trimester one, symptoms and body changes. So first of all, symptoms, this is usually the most rough trimester. You're going to feel really nauseous, fatigue, vomiting, some mood swings, frequent urination, food aversions, and lightheadedness. And many times that's how you find out you're pregnant is from those symptoms. And your belly's going to slowly start to grow. So you start to get kind of that look of like, okay, do I have the bump? Is it a food baby or am I pregnant? You know, it's kind of that question. Um, oh, sorry. Can we just go back to that other
Oh,
slide?
yes. Sorry, I didn't mean to click
No, that's okay.
that.
Workout and nutrition modification. So really nothing changes in the first trimester. With nutrition, we highly suggest that you're eating like at your maintenance calories. So say your maintenance calories is 1800, you would just kind of stay around there. Again, workouts kind of stay the same. You aren't going to want to focus on like hitting, intense PRs. This isn't like a time where you're just going all hard and lifting super, super heavy. But you want to be strength training. You still want to get to the gym. You still want to be, lifting weights and doing kind of the routine that you were doing, before pregnancy. If you are new to working out and you're deciding like, hey, I want to be, healthy and active throughout my pregnancy. I want to start strength training. I really suggest just doing, lighter weights to start just because you're new to it. Ab modifications, there's none needed. You can continue to do abs in your first trimester. Just a couple of things that are recommended for movement is, walking, swimming is great. Of course, continuing that strength training. You can start some prenatal yoga. And then just a couple things to start avoiding are like contact sports, overheating, and then lying flat on your back for a long period of time.
Okay, and then when you get to the second trimester, which I believe is like after week 13, This is when you're going to have to start modifying things with your workouts a little bit more. And that's just because the baby's growing, the baby's taking up space. You're going to have a little more weight gain. You're going to see the bump. Hopefully your energy picks up. I know so many of us are like exhausted trimester one, then energy picks up. We feel really good by the second trimester. So hopefully that comes back for you and you can get that movement in again if you had to rest a little bit more. You might find yourself being hungrier. Your nutritional needs do increase. So while you don't need any more calories at the beginning of pregnancy, you will about the second trimester. And again, all these guidelines that we're giving you guys are ranges. Please keep in mind that you are different. Your pregnancy postpartum experience is all going to be different. It's not going to be like perfectly by the book, but these are generalized guidelines. On average, you need about 300 to 400 more calories a day during your second trimester to support the baby's growth. You are growing, so it's important that you start focusing on your core and pelvic floor exercises, which will real quickly walk you through something to kind of be in tune with the muscles that you need to. Continue to strength train instead of doing your typical crunches and sit-ups like you were okay to do before. You now want to transition to doing your deep core breathing and deep core exercises, which we'll show you a few of those. What you need to try to remember is your baby is protected and should be treated like pretend your baby is a house. That's how we were taught in our certification. So your stomach is the house of the baby, and you don't want to lay on the house. So don't lay on your stomach. You don't want to twist the house, and you don't want to crunch the house. So we're not going to be crunching. We're not going to be twisting as much as we can help in our core. And obviously, don't lay on your stomach when you have the bump there. So protect that area, but you can still train your core. And in fact, it's really important that you train your core because if you don't, you're way more likely to get pelvic floor pain, hip pain, diastasis recti. It helps with recovery, and back pain. So that's one way that you can kind of prevent that. So let's just walk you through how to do a core breath. Super, super simple. And even if you're not pregnant, you should know how to do this. I feel like we don't really know how to do that. Essentially, what you're going to do is you're going to take a really deep inhale. So do it with me here. Take a really deep inhale. And as you inhale, your belly goes out like a balloon. So your stomach should go out. Inhale and hold it. Your stomach's out as far as you can. And then you're going to exhale. And when you exhale, you're bringing your stomach back in. Try to think of a string pulling your belly button to your spine. So you want your stomach to get as tiny as possible. So if this is my belly here, you're going to inhale. Exhale and bring your stomach like you're sucking in almost as tight as you possibly can. This is working your transverse ab or your corset muscles that wrap around your waist. This is going to help protect your lower back, protect your spine, and also help with healing postpartum. So this is something you should be doing every single day from basically second trimester on. Be practicing that because this is also going to help you be in tune with the muscles you need for labor or for postpartum. And then at the same time, I'll real briefly touch on this. While you're doing that, once you have that motion down where your stomach goes out when you inhale and then comes back when you exhale, you're going to start to think about your pelvic floor, which is the muscle. If you don't know how to target your pelvic floor, when you go pee on the toilet, stop the stream. And that muscle that you're using to stop the stream is your pelvic floor. You are going to, at the same time, when your belly expands, you're going to push your pelvic floor to the ground. And then when it comes back, your pelvic floor is going to go up. So again, just imagine a balloon. If you're having trouble with the visual, a balloon's going out and down, pushing your pelvic floor down and your belly out. And then when you exhale and there's less air, it's all coming back up. You want to get in tune with that pelvic floor muscle. It's going to prevent you from peeing your pants. It's going to help with so many things with the baby. So start doing that, whatever stage you are. If you're pregnant, postpartum, you can start doing that right away.
Yes. And I put in the chat, I still do it 2 years postpartum. I do
Yeah.
core breathing several times a week. Okay, trimester 3, you're really showing and you're feeling it. So, baby is growing rapidly and preparing for birth, dropping into the pelvis. You have some fatigue still, shortness of breath, swelling, probably in your ankles, probably experiencing some Braxton Hicks. You're very uncomfortable, so you're having trouble sleeping. Baby might be keeping you up at night as well. And you should have an increased appetite as well. Diet and workout modifications. Nutrition, 500 more calories a day is what you should be having. Again, it varies from person to person, but that's just a rough estimate of where how many more calories you should be having at this point in time. For working out, it's recommended for light strength training or even just body weight movements. Squats, stretching, hips and pelvic tilt to prepare for labor, continuing those deep core breathing like we just showed you, and then getting in movement, of course, with walking. I really encourage my pregnant clients to just walk as much as they can, as much as they feel comfortable with. We know you're probably going to have to rest more, right? Put the feet up a little bit if you have some swelling and things like that. But you really want to really focus on preparing your body for giving birth. So focus on some mobility, flexibility as well, and then of course the breathing exercises. Some things to avoid are exercises requiring balance. Again, lying on your back too long. Any kind of intense cardio, you just want to do some walking, and of course anything that's going to put any kind of strain on your core. And of course, like Chelsea talked about, our belly is our house for our babies. And so for abs, no crunching, no crunches, nothing at all. You want to avoid anything that has to do with squishing or laying on your belly.
All right, so we are going to talk about weight gain during pregnancy. Let's start with saying that weight gain is normal, necessary, healthy part of being pregnant. I know that mentally it can be something so many of us struggle with of watching the scale go up or watching your sizes go up, but you just need to remind yourself like how beautiful it is, how important it is, and that if you weren't gaining weight, that wouldn't be healthy. So it's a good thing. It's a positive thing. Like yes, we want to minimize it. We don't want to gain an unhealthy amount for your health and baby's health, but weight gain is normal, it's healthy, and it's necessary. And understanding why we need to gain weight or where that weight is going is very, very helpful. The more you know, the more comfortable you're going to be with everything because you just understand what's happening to your body. So what's normal? Again, these are, please understand generalizations. If you've gained a little bit less than what's normal, a little bit more than what's normal, like if you're healthy and everything's okay by your doctor, don't stress, but these are generalizations. 15 to 40 pounds is considered healthy weight gain for the general population of women. If you are underweight to begin with and you have a very low body fat percentage, you may need to gain more weight. So closer to 30 to 40 pounds if you're underweight that might be needed in order for your specific body to support a healthy pregnancy. If you are overweight or obese, you shouldn't gain quite as much. You should gain less because your body does not need to put on any extra body fat. It might have more than it needs already. So you don't want to add to that strain on your body. You only need to gain the weight that is associated with the baby and the fluid. So if you are obese to begin with, you might only need to gain 15 pounds to support a healthy pregnancy. What is all that weight from? On the diagram, you can see generalizations that it goes to your breast tissue, your uterus, amniotic fluid, placenta. You have more blood in your body. All of that weighs something. And then in general, women do put on a few pounds of body fat to support pregnancy. And that is your body's natural way of making sure you have enough energy to breastfeed your baby. If you weren't to give it calories in the postpartum phase, it would be able to pull from your fat stores or energy stores. So the body's working for you. It's really amazing. I know sometimes these changes are uncomfortable or confusing, but your body is doing what it needs to do. And it's really, truly amazing that it's prepping you and your baby for what it needs. And again, why does it matter that we keep an eye on your weight? Why is your doctor crazy about your weight at your checkups? Like, why do they need to weigh you every couple weeks or how often you have to go there? And that is because if you gain too much weight or not enough, it puts you and baby at risk. So as we hit on before, if you gain too much weight, you're at higher risk of having gestational diabetes, really large babies, which are dangerous for you also the baby, high blood pressure, becoming preeclamptic, which can lead to organ damage and even be life-threatening, postpartum weight retention and swelling, and that's just going to make you uncomfortable. You are way more likely to have back pain and hip pain. You are more likely to have an increased risk of having diabetes later in life if you got it during pregnancy, and a higher risk of having an emergency C-section, and risk for the baby too. It's not just you, but larger babies have a higher risk for obesity later in life, diabetes, heart disease, or I thought this was interesting, but if you gain too much weight during pregnancy, It's like one or the other. You're more likely to have an underweight baby with fetal growth restriction, and you're more likely to have an oversized baby. So very interesting, but either way, the baby is not the size that they should be for their health if they have this condition. So you want to make sure that you're doing what you can to gain weight, but not treat it like you're eating for two. Still be active, still watch your portions, and remember that it's important that you're getting enough nutrition, but calories don't need to be doubled. So food choices do matter. Okay,
Oh,
so
oh, sorry. Go ahead,
go
Chelsea.
ahead. Was
No,
this
you're
yours?
good.
Okay, postpartum. And I don't know if I can screen share at the same time. Oh, yes, I can. Okay. So I'm actually going to pull up just a few videos for you guys if you are pregnant or postpartum. Hopefully this can help you. But week 1 to 2 postpartum, focus on your baby. Like, don't worry. I know so many moms are like, I'm ready to lose the weight. Like, it's time, baby's out. Let's get on this. And like, I love the enthusiasm, but try to just soak it in. Like, the first few weeks, do not need to be about weight loss. Like focus on baby, focus on bonding. I'm all for moving your body because that's going to help you physically and mentally. So good for you. But just do walks, whatever you feel like you can tolerate. Nutrition, focus on eating adequate calories for your body to heal. If you're breastfeeding, you are going to need to focus on having your milk come in and eating enough for that. So weeks 1 and 2, I'm just briefly going to show really, really quick because I don't want to take too much of our time on this. But weeks 1 and 2, you can do a few things. Well, one is my beautiful mom. One is core breathing, which is what we kind of walked you through here, but here's Kayla performing it. You can see her do this. So you can do this day one. Okay, you just popped out your baby, start your core breathing. And this is because this is going to help you heal. This is not about building abs, or becoming skinny, okay? This is about healing and taking care of your body postpartum. There's a lot of healing that's going on internally. So this movement can help. And then we have this movement here too. Transverse abdominis. I'm going to silence it here, but you can see she's essentially doing something very similar to core breathing. She's coming and putting her hand on her stomach so she can feel her belly expanding and going up and down, doing this deep breathing. And she's also really focused on her pelvic floor, going up and down for that healing. So you can do these. This is week 1, 2. That's the only movement or exercise you're going to do besides walking. So grab those two movements, kind of tuck them away in your memory. But those are things you can do right away. You don't have to be scared of doing that. Weeks 3 and 4, it's going to be similar focus, right? You're still healing, you're bonding, you're focused on eating enough calories for healing, and then you can progress to a few more exercises if you are comfortable with doing so. I remember I always used to think like, oh, I needed to wait until my doctor cleared me to even do like any of this. But learning about how to do these things that you can actually start them right away. Was helpful for me because sometimes you're just like wanting to do something to feel better. So here's another movement you can do in weeks 2 to 4 postpartum that's just going to help you to target that pelvic floor and help with healing. This is just a sideline bent knee lift. So you can do this during pregnancy and recovery. A lot of the things that we have our clients do during pregnancy are kind of to prep their body for postpartum and to get you in tune with those muscles. Okay, week 5 and 6, we do advance a little bit more. So week 5 and 6, if you're comfortable with doing so, you can progress to bridges, which these are targeting your pelvic floor as well. So again, hopefully you're getting in tune with hitting that muscle with your core breathing. You can do some bridges. Again, no weights, just body weight. You can do some of these. You can do seated marches, which again, these are things we have our pregnant clients do. And then you can do these postpartum. These are going to hit your core and they're also going to hit your pelvic floor. And it's just this couple inch lift on either side. And I'll show you one more. And this is another one that is postpartum safe that you can do pretty quick. And this is going to be, you're going to keep your core tight. I think it was like 5 or 6 weeks postpartum here doing that. And it felt really good. You're going to just keep your core tight and move your arms up and down. If you don't have a ball, just grab like a very light household object. So those are things you can do technically before you're even cleared to work out. I wouldn't really call it working out. You're healing and restoring your core and pelvic floor, which you can start right away, which might start making you feel just a little bit better. Okay, let's get back into this mode here. Okay, and then once you hit 6 weeks postpartum, this is generally when you are cleared to work out and to have sex by your doctor. I would like to say I don't think they help at all. Like, I don't think they give any guidance of how to ease back into stuff. Not everyone should be having sex at week 6. Like, you might still have a lot of pain. You need to be in tune with your body and listen to your body. Don't do something that's going to hurt you. Don't put pressure on yourself to be doing what you were doing pre-pregnancy, whether that be sex or workouts. You need to ease back into both of those things in a way that feels comfortable for you. And I can't stress that enough of listening to your body and doing what feels good for you. So ease back into all these things. Don't hurt yourself by jumping back into everything. Start really light with body weight when it comes to working out. And then you can always progress, right? It's better not to hurt yourself. You can't take weight away if you did something that's going to hurt yourself. You can always add more. So start very light. And then what you're going to do is continue to do those deep core breathing and pelvic floor rehab as opposed to your traditional ab work. So if you want to screenshot the list here, I'm not going to go through each of these movements, but these are ones that are more safe for postpartum. And then you can eventually, like, we're talking months down the line, everyone is very different, but months down the line, progress your core movements to more traditional ab work, not right away, not in the first couple months. And then if you see these pictures here on the side, this transverse abdominis, that's the muscle I was talking about. That's your corset muscle. It's a muscle that kind of snatches everything back together and pulls everything, protects your lower back, protects your spine, helps heal diastasis recti. That's what we're targeting, not your rectus abdominis, which is what everyone thinks of when we're talking about working your core. But there's actually a lot more to working your core than just training your rectus abdominis on that bottom picture there. And this is something, again, even if you're not pregnant or postpartum, like we should know how to do this. You would have a tighter core, you would protect your lower back. These are muscles that we need to know how to engage for lifting, anyways.
Okay, we're going to dive in and just really, really briefly talk about C-section recovery. Any mamas out there that had a C-section? So you are going to ease back into movement post C-section. So normal activities like getting up to eat is something you can start with, but it's important that you are not moving much more than that. You're going to avoid lifting anything heavy, like doing laundry, vacuuming, anything like that. Even with your baby, you're going to need someone to probably come bring baby to you, at least for the first couple of weeks. C-sections are major surgery. I know sometimes we think like, oh, you should just be able to get back to it, mama. But no, like it takes time. So give yourself that time to recover. You're not going to feel like doing much more than just like getting up from your bed and back for the first couple of weeks. So once you're cleared at 6 weeks and you have that appointment with your doctor, then you can slowly start adding in body weight movement, or you might just want to start with some of the core breathing and work your way up to the body weight movement. And then you can start getting in, some walks and things like that. Obviously, avoid crunching, sit-ups, any kind of movement that's going to put any kind of pressure on your incision. Um, Make sure that you avoid extending your back and that you are focusing on just standing nice and tall after you've had a C-section. From the surgery, you can feel that tightness and pulling when you stand up. So make sure that you are just not putting any extra pressure on it. You could wear an abdominal wrap recommended from your OBGYN that can help support the incision, abdomen, and minimize any pain that you're experiencing. And then I know the scar is like a big one that many of us talk about. And if any of you have had a C-section, if you want to share just some ideas that you've and some different things or creams even that you've tried to help with your scarring, you can start to massage your scar tissue after 8 weeks postpartum, possibly 6, depending on how your appointment goes with your OBGYN. But this can help loosen up any newly formed collagen. It keeps the tissue mobile, reduces pain and tightness. And then I've heard too, like rubbing kind of different textures on your scar just to kind of get like that feeling used to it again, makes a big difference. So again, big thing with C-section is give yourself time to recover. You're going to have a couple of weeks where you're not able to get up and do much, and that is okay. I know it's hard with being a new mom. There's lots we want to do, but have that help, have that support, let it heal. Do the necessary things that you need to do to let it heal. And then from there, you should hopefully be good to go. But yeah, if anyone has any suggestions with creams or things that they used with their C-section, please drop it in here because I know other C-section mamas would love some different tips and ideas and things that worked with their scarring so that it was very minimal.
In the chat, someone said, my doctor told me C-section are the second largest surgery next to open heart surgery and lung transplant. So yes, give your body rest, and grace.
Yes, it's just wild to me.
All right, I'm going to kind of pick it up so we don't keep you guys too long. And this is probably what many of you guys are here for is the postpartum weight loss. So first of all, I want to stress, like you just had a baby. You brought life into the world. Think of yourself as like a fertility, beautiful goddess and try to remind yourself of that. I remember reading that in our postpartum certification and just reminding myself that like this is a beautiful gift. I brought life into the world. It helped me so much mentally, like reminding you use terms like goddess and things like that. And I know it's so silly, but like those mental things really do help. The way you talk to yourself, like you are bringing life into the world. This is like a beautiful, beautiful thing. And if you can keep that at the forefront of your mind, it makes all of these things feel so much more okay. At least for me, it did. So just know, be gracious with yourself. Most women are going to have a dramatic weight loss the first 6 weeks. That's because the baby placenta fluid, all that comes really quick. So you might be like, oh, I lost it really quick. And then it might slow down and then you aren't losing very much at all. And that's probably because the rest is what's gained was fat. And that's just going to take a little bit more time. That's going to take women on average 6 to 12 months. And yeah, be patient with that part. Okay, so you'll see a dramatic drop and then it's going to slow down. Many women don't go back to losing the weight just due to habit change and lifestyle change with having a kid. And we are big believers that you do not have to stay there. You 100% can lose the weight. You can look better after kids. You can feel amazing after kids. Like we help women do it every day. We did it ourselves. We don't believe that you have to adopt this. Oh, I just have this body now that I'm a mom. I hate the narrative that kids destroyed my body. I hear that sometimes. I'm not saying there's not changes. I'm not saying you won't have some things, but if you talk like that, you will step into actions that follow that pattern. Like, oh, my body's destroyed. How are you going to show up if you think that about yourself? Like, don't talk to yourself like that. Definitely watch the way you speak around your children. I would never want to tell my kids they destroyed mommy's body. The way we talk is really important. Remind yourself that your lifestyle can get you back to where you want to be 100%. Breastfeeding burns a ton of calories if you are breastfeeding. So this is something to think of when you're trying to lose the weight. When you are ready to go into a deficit, I recommend waiting 3 to 4 months-ish on average. And that is just to make sure breast milk supply is good if you're breastfeeding. Make sure that's established before you try to drop calories because your body needs, again, 500 to 800 more calories just to create and produce milk. Your body's working so hard. So give it fuel that it needs for this. And then you can enter a deficit, but it's going to have to be a lot higher than normal. So if a deficit for you before all of this would be 1,500 calories, you're actually going to need to be at 2,000 to 2,300 calories to lose weight to account for breastfeeding. And you will still lose weight at that 2,000 to 2,300 because of breastfeeding. Now, there is a ton of nuance to this, which is where like our coaching really comes in because some women are combo feeding. You won't need as many calories as someone exclusively breastfeeding. Maybe you're weaning off. Like there's a lot of nuance to all of this. These are generalizations. If you have twins, you might need even more. It's a lot of food. We tell our girls to hit within 100 calories of their target deficit goal in our app, eat high protein, and foods that support milk supply are listed down there below. If you are not breastfeeding, you don't have to worry about the extra calories. You can safely enter a deficit. But again, we still kind of recommend waiting at least a couple months just to allow your body to heal before you enter that deficit.
Okay, so postpartum weight loss. Let's chat a little bit about that. So, you can lose weight in postpartum. You can, like Chelsea was talking about. So, with formula feeding, like Chelsea was saying, we want to wait a little bit, give your body that time before you start diving into tracking food in a deficit. And I know sometimes that's hard, but you are going to just want to focus on being present with your baby, finding a routine, all of that. Tracking food will come. You'll get to getting back into a routine with tracking food things. So just give yourself that grace, 1 to 2 months before you really worry about tracking food. You're going to want to eat to heal and have energy. So what you are putting into your body matters when you are wanting to see those changes when it comes to losing fat. So make sure that you are having a good, adequate amount of food, first of all, for energy, just to give your body fuel, to make sure you're eating as a postpartum mom. And then when you are ready, when those couple months have passed, then you can start with a slight deficit of about 300 to 400 calories. And it's really nice if you have someone that can kind of give you those calories. It's kind of know where to start, but about 300, 400 calories is where you want to start from your maintenance. So you want to know your maintenance calories, and then you can slowly, very slowly drop from there. Movement, you are going to get back into weight training 3 to 5 days a week. Start with three. That's definitely where I would start. And you start with light weights. Again, you don't need to go hard right away. Just start with some light weights, get your body back into getting in those movements. Muscle memory is an amazing thing. So just know that will come with it as well. Walking, get back into steps. This will also feel really good just to get out and move your body with your baby. Sometimes being inside when you're newly postpartum can be hard. So get outside, get some fresh air, hopefully, if weather will allow it. Bring your baby, put your baby in the carrier, stroller, and get outside and get that sunshine as well. That's so important for our mental health, which we'll talk about in a second here. And just manage expectations. This one's huge, mamas. This one's so important. What is going to actually be realistic for you? Okay. So, not setting these really hefty goals that just may not happen right now because you're navigating mom life, you're navigating just how your routine is going, how everything's looking. Things are going to look different, and your time is not really your own. You're still going to have time to do things for you, but it's going to look different day to day. There's going to be a lot of grace involved. So have that expectation of just lowering it a bit, be realistic with yourself, and just start by doing these little things each day, and you'll start seeing those changes in your body.
Especially if it's the first baby. I feel like baby two, I had it down, but baby one, like, rocked
Oh,
me. I was not ready for expectations. Like, management was
yes.
really off of what I thought I could do with a baby. So if it's baby
Same.
one, give yourself a minute. Your goals will be there, baby steps.
Yes, the same thing happened with me postpartum. It shocked me. But just really quickly, we want to chat just a little tiny bit. I could do a whole call on mental health postpartum, but we are just going to just chat a little bit about it. So it is so important to take care of your mental health postpartum. And I know some of you are newly postpartum on here. So just going to give a couple of things that you can do when it comes to your mental health postpartum. Try to just do one thing for you each day. And I know it might seem like you just don't have the time, but one little thing, whether it's just calling up a friend and chatting with them, maybe it's going for a short little walk, maybe it's going to Starbucks drive-through. I know I did that one day. I'm like, I just want to get a coffee. I just want to get out. Maybe it's reading a few pages from a book. Find something that fills your cup that you maybe did prior to baby that just feels really good to you. Again, have realistic expectations, give yourself grace when it comes to starting your journey. It took you 8 months to a year. It's going to take 8 months to a year to be fully recovered. And just think how long pregnancy took. It took you that long to grow a baby. So it's going to take you that long to see those changes in your body and just mentally get back to a good place too. So grace, grace, grace upon grace, give yourself. And body image. I know our body, we want it to go right back to where it was. But again, it's going to take time. So instead of focusing on, I want to get there, I want to look like this, I want to look like this, just really, first of all, appreciate your body, take in all that it's done. And I know one strategy that you can do with it that I know I did was just like writing down things that I love about my body, that it's doing for my baby, that it did for me throughout my pregnancy, through giving birth, postpartum, what it's doing for me right now. Just take some time to really reflect on that each day. Ditch the scale for a while. You don't need to weigh yourself, right? Just ditch it. You don't need that. Sometimes getting off social media, sometimes a lot of comparing can happen on there. We compare ourselves to other moms that are postpartum, and that just does nothing for our mental health. So even just taking a break from that would make a big difference too. Really quickly, I want to share with you ladies one of my incredible clients. Her name is Kelsey. She is a mom of five, and she healed her diastasis recti by joining our program. So, Kelsey came to me and she told me she had twins, you guys, and she had severe diastasis recti from carrying her twins up to 39 weeks, and she delivered them vaginally, which is incredible. But she said, Kayla, I've been doing just normal ab work that I did before pregnancy, and it's like very painful. She said, I'm not seeing a change. And she said, I have very severe back pain. And so she joined our program. Some of the movements that Chelsea showed you, we started incorporating into her program each and every day. And she said, she's been in our program for just a couple of months, and she has noticed a major difference in her diastasis recti. It's down to half a finger width, which she's like, I've never seen before. So, and then she said she has less back pain, which now allows her to do other strength training exercises that she hasn't been able to do. So it's made a huge difference, and I'm just really happy for her. And it's all from doing some core exercises and knowing what to do and how to do them.
5 babies.
I
Woo,
know. She's amazing. Look
looks
how
so
normal she
good. Yeah, five.
is.
Oh, and another client that is currently in the program right now. This is my client Alicia, and she's a mom of three. She's down 20 pounds in the program, and she had major, like really severe diastasis recti, and you can see it on the picture on the left. To know if you have it, you can do a quick sit-up test in your home where you lay on the floor and then you sit up. And if you have a cone shape, you can see it here on her in the left without her even doing that movement. That cone doning, that is not fat, that is her ab separation that's causing that shape of her stomach. And she was really, aware of it, a little bit insecure about it, and she had had this since 2016. So she came to me like, hey, is there anything we can do about this? Literally, what is that, 9 years later? She's like, I haven't had like a normal stomach since before kids. And so, at being this long in, I was truthfully like, I don't know how long this is going to take. I don't even know if you might need a lot more help than what we could maybe provide. You might have to go to physical therapy. You might need to have potential surgery, which is like really extreme cases to fix it. But she's been responding beautifully to the right program, the right exercises. She's lost inches in her stomach. The coning is going away and it's going down slowly. I think it's like 4.5 months or something we've been working together. Extreme progress. And again, she's been like this since 2016 and she's so happy. And one thing she told me that she didn't even realize was related to her diastasis recti was she had severe hip pain since 2016. She had gone to all kinds of people to get this hip pain looked at, and they never tied it to it being her core separation. And when we started to heal her core and her pelvic floor, her hip pain is gone. And so she's like, that is the most, like, losing 20 pounds, great. But she's like, the best part of this has been my pain is gone. I woke up every day having pain and now I don't. So, like, there's so many things. It's more than just how you look like. When your body is not aligned, when it's not working how it should, you're not going to feel good. You're not going to function well. So this is what we help you do during pregnancy and postpartum so that hopefully we can help you avoid having, 9 years of pain and dealing with these kind of things. But if it's been that long, hopefully we can help you get back to feeling good. And here's just a few more mama transformations that we help with the same things with body fat loss post kids and healing and restoring core and pelvic floor issues. So these are just a few of the mamas in our program.
So proud of all of them.
Yeah.
So we just want you ladies to know on this call, like we are here to help you as well. We want to share a little bit about our program, whether you are pregnant right now or you are postpartum or even pre-pregnancy. We want to help you whichever stage of life that you are in. And we do this with our program, with our custom nutrition for you. So again, whether you're postpartum, you're a breastfeeding mama, or you're pregnant, our custom nutrition is going to help you stay healthy, active, or postpartum. If you're working on the fat loss, we will help you with that. Our workouts, as you saw and we talked about, they're all customized, whether you're pregnant, whichever trimester you're in, postpartum, newly postpartum, we're going to work on those core exercises, healing diastasis recti. We make our workouts for you wherever you are at and what your goals are. And a beautiful thing is too, mamas, is we go around your schedule. That's the beauty of this. We are not like 5 days a week, an hour at the gym. No, no, no. We make this fit your schedule. So if you're like, I just don't know if the time, everything that we do in the Slay Squad, we make fit your schedule so that it is doable for you and your busy lifestyle. But of course, you are getting those results along the way. Support, we are here to help you one-on-one as your coach, Chelsea or myself. We want to help you every single step of the way. We are going to give you all the feedbacks, all the tips, tricks, things that you need to help your journey and get you the results that you're wanting. If you're stuck, if you are having a tough day, we are there for you every single step of the way. Education, we are huge on education, the Slay Squad. We want you to know the why behind things. We want this to be something that you continue on even when you finish with us. So we have lots of education in our course. We do Zoom calls just like this over topics that you're needing help with. So again, lots of education. And then one big thing that is huge, especially if you are a mama is just having that community, having other women that can relate to you, other women that can go, yeah, I'm in the same boat with being a mom and, having these goals. So you're going to want some community and support. And we have, goodness, like over 250 women right now that have the same goal as you, is just being the healthiest mama that they can be, whether it's throughout their pregnancy or postpartum. So that's what our program looks like in a nutshell. And we have a special offer that we want to give those of you that are on our call right now. Um, let's see here. Are we able to go to the next slide, Chelsea?
Yeah.
Here we go. Perfect. So if you are wanting to build a body that you love after having babies, or if you are wanting to have your healthiest and fittest pregnancy, or if you're someone on this call who's like, hey, I'm wanting to get pregnant. I really, I want to be able to hopefully conceive in the next year or so. We are here to help you every step of the way and make your health a priority. So our special offer that we want to give you tonight is $300 off our program. So you need to book a call with us. Our call links are in the chat. Myself, Coach Chelsea, Coach Lindsay dropped hers in as well. She's on this call. We would love to chat with you. This is a no pressure call. If you just have questions about our program, there's some things you're wondering, maybe you're thinking that this is the next step that you need to take in order to reach your goals, please book a call with us. Book a call. Our link is in the chat again, and we would love to chat with you. And again, we're offering $300 off, and this offer is only going to be for a week. So book a call sometime this week so you don't want to miss the offer. And we look forward to hopefully chatting with you more about our programs.
Yes, so if you're wanting to lose weight or just have a little bit of support with healing your core or anything like that postpartum, that's what Kayla and myself specialize with. And I hope this was helpful. I hope you learned something. Drop a fit mom in the chat if you plan to implement any of this throughout your pregnancy or postpartum. Just type fit mom. And regardless of whether or not you plan to work with us or not, we're here for questions because we really want everyone to be inspired to have just a healthy and empowered pregnancy and not be, looking to their old self and just longing to be that person again. Like who you are now is going to be different, it's going to be amazing, it's going to be incredible. And we really want to help you step into that and just love this journey because you're not going to love this journey of motherhood if you're always looking back and sad about who you are now compared to who you were. And that's what we really want to help you to see and see how amazing life can be and how amazing you can feel in your own body as a mom. That's what we want for all of you guys. So
Yeah.
thank you guys. Yeah. Anything else you want to add, Kayla?
No, that is it. You can truly have your best body after having your babies. And I know Chelsea and I,
Yeah.
like we shared, that's exactly what we did. And we want that for you. So yeah, please reach out to us. And like Chelsea said, if you have questions, we're here for you.
Yeah.
Anything that you need, reach out to us.
Yes. Have an amazing night, and I hope you guys learned something. Bye.